Welcome to the COOP for Rural Hospitals webinar series. This is webinar 5, Facilities, Devolution, and Reconstitution. In this webinar, we will continue to review COOP planning elements related to infrastructure and supplies, evacuation, and recovery.
Before we begin our webinar, let's review the components of the Rural Hospital COOP Toolkit. While this toolkit was designed specifically for rural hospitals, other hospitals or other healthcare organizations may find benefit from the elements in the toolkit. This toolkit has been specifically designed for rural hospitals and includes 6 components which you see listed on the graphic on the screen. The first component is a COOP plan completion guide, and the second component is a COOP plan template. These are designed to work together to help hospitals customize their COOP plan. The third component is a COOP tabletop exercise in a box that includes all the materials you would need to design and conduct a tabletop exercise at your hospital. The fourth component is a collection of resources related to COOP planning, specifically COOP planning industry standards and best practices. This curated list of resources may be helpful as you write or update your hospital's COOP plan. The fifth component is a frequently asked questions document to help you explain COOP planning to your peers and executive leaders. The sixth and final component of this toolkit is this series of webinars to help continuity planners complete or update their hospital's COOP plan. The webinars are focused on the first 2 components of the toolkit, the COOP completion guide and the COOP plan template. The completion guide has been designed with activities and explanations of how to write a COOP plan for your organization. As you complete the activities, you can move answers into the COOP template. The template can be edited or adjusted however you see fit to meet the needs of your organization. If you already have a COOP plan, you can use the completion guide to help augment or revise your current COOP plan.
And now for webinar 5, Facilities, Devolution, and Reconstitution. In this webinar, we will continue to review COOP planning elements related to infrastructure and supplies, evacuation, and recovery. To follow along, please have the COOP completion guide and COOP plan template available. If your facility already has a COOP plan, you can have that available as well.
This is a roadmap graphic that describes the 4 phases of COOP planning, and each phase corresponds to a bend in the road. There is a red chess piece that will move with us as we progress through this roadmap and progress through the webinars. Step 1 in the COOP planning process is to prepare. Preparing includes building your COOP planning team and setting up your project management plan, as well as understanding the COOP planning elements and the regulatory environment. Webinars 1 and 2 focus on step 1. Step 2 in the COOP planning process is to write your COOP plan. Webinars 3, 4, and 5 guide you through writing your COOP plan and using the COOP completion guide and the COOP planning template provided in the toolkit. Step 3 is to train and exercise so your staff know how to activate the COOP when needed. This will be covered in webinar 6. And finally, step number 4 is to evaluate and improve your COOP plan. This will also be covered in webinar 6. We will refer to this roadmap graphic and the 4 steps of COOP throughout this webinar series.
Here we see our roadmap again, and our red chess piece has moved to step 2, COOP. In this webinar, we will focus on identifying an organization's COOP facilities, devolution, and reconstitution planning elements. We will build on what we discussed in webinars 1, 2, 3, and 4. Again, please have the COOP completion guide, COOP plan template, and your current COOP plan, if you have one, available. If you want to follow along in real time, you can pause this webinar at any time. The first COOP planning element to review is continuity facilities, or alternate work locations. Alternate work locations are locations from which leadership and critical positions may operate during a continuity event. Internal as well as external alternate work locations need to be documented. When working to identify these locations, try to answer the following questions. What supplies do you need to perform essential functions? Do these locations need to have generator power? What is the minimum amount of square footage needed? Are there agreements or memorandum of understanding, MOUs, in place? It is recommended to build a matrix of all alternate work locations as a quick reference document. Review the essential functions and supporting essential activities and identify the internal and external alternate work locations. There is an internal alternate work locations table and an external alternate work locations table in your COOP plan template where results can be documented. We will continue to use food services as our example. An example of an internal alternate work location for food services would be the staff break room, especially if it has a water source, stove or oven, and refrigerator. An example of an external alternate work location for food services would be a local community center kitchen. The next COOP planning element to review is Reconstitution. Reconstitution is the plan for resuming normal business operations while maintaining essential functions. The overall objective remains to ensure essential functions continue, regardless of whether an organization is working towards resuming services or is in the middle of a real-world emergency. This section of the COOP plan should identify when and how a return to normal business operations would take place as a result of a continuity incident, and how paused services or non-essential functions will be resumed. This will typically be a robust section of the plan, and department-level COOP plans may point to the organization's COOP plan for how their individual department would look to leadership for guidance and direction on how to approach reconstitution for their individual department. Finally, the facility may already have a recovery plan as an annex to its EOP. Before writing a reconstitution plan, check with the lead for policy development, emergency management, or legal subject matter experts to avoid duplication of effort. While a recovery plan would not cover all aspects of reconstitution planning, there may be a significant amount of overlap, and an organization will want to ensure alignment with any existing plans. Review the reconstitution section in the COOP plan template. Update the language to reflect the facility's specific information and reference any recovery planning documented in the EOP. If your organization is working on department-level COOP plans, consider referencing the organization's COOP reconstitution planning section and removing any additional language. We will continue to use food services as our example. An example of reconstitution for food services would be outlining the resumption prioritization of non-essential functions. In Webinar 3, we identified serving food, cleaning up, and ordering food as non-essential functions of food services. A component of reconstitution planning is prioritizing the resumption of normal business operations while maintaining essential functions. For food services, this might be resuming the responsibility of serving food and then resuming cleaning up, which could include cleaning up the dining area or patient room trays, and finally resuming the responsibility of ordering food. This order prioritizes resuming the most time and labor-intensive activities first, but a department or organization may choose to approach this differently. The last COOP planning element that will be covered in this webinar is devolution. Devolution is the capability to transfer statutory authority and responsibility for the organization's essential functions from the primary operating staff and facilities to another organization's employees and facility. Devolution is the last resort for maintaining an organization's essential functions and typically is a result of a catastrophic failure. Many healthcare facilities have plans in place for evacuation, which could serve as or support the devolution planning process. Think outside the box. Consider partners outside of the immediate vicinity and potentially outside of the state. Collaborate with partners. Talk with local emergency managers, public health, and healthcare coalition representatives. They have extensive local and state networks, which may support the organization's devolution planning. Review the essential functions and supporting essential activities, and identify potential devolution partners by each essential function. There is an essential function devolution of control matrix table in your COOP plan template where results can be documented. We will continue to use food services as our example. In webinar 3, we identified preparing food as an essential function of food services. An example of devolution for food services would be transferring the responsibility of preparing food to an external partner, such as a sister facility, a local restaurant, or catering business, a school, or community center. That brings us to the end of webinar 5, Facilities, Reconstitution, and Devolution. In the final webinar, we will complete our review of the How to COOP, a roadmap, and review Step 3, Train and Exercise, and Step 4, Evaluate and Improve.
This webinar was prepared and recorded by All Clear Emergency Management Group under contract with the Minnesota Department of Health Emergency Preparedness and Response Division. If you have any questions, please see their website at www.health.state.mn.us/about/org/EPR.